Most people think that allergies is bad luck or bad genetics. But what if your allergies, food sensitivities, and mast cell issues is actually a sign that your body is overwhelmed and not properly breaking down histamine? In this video, I'm going to walk through the 5 things that I use in my practice, not just to manage allergies, but to actually support the body so that it stops reacting. And I'm not just going to give you vague tips. I'm going to give you exact dosing, how to take them, and even a protocol you can start today. One of my favorite herbs for allergies is stinging nettle leaf. This is not just a natural antihistamine, it's also deeply nourishing, which is something most people with allergies are actually missing. It's rich in calcium, magnesium, potassium, silica, and even iron. And what I see clinically is that people with severe allergies often present as cold, damp, and depleted. Lots of phlegm, low energy, weak digestion. It works by helping to reduce histamine release and gently block histamine receptors, which also provides the minerals your body needs to regulate the immune response more appropriately. How I use it is 2 tablespoons of dried nettle leaf and about 30 ounces of filtered water, and I let it sit in the sun for about 6 to 8 hours. This helps extract more of the minerals, not just the active compounds. This becomes a mineral-rich infusion that you can sip throughout the day rather than drinking it all at once. This helps with calming the histamine response, reducing inflammation, supporting the nervous system, and supporting long-term healing for allergies, asthma, and chronic illness. Next is vitamin C, which is one of the most underrated tools for allergies. Vitamin C helps break down histamine and helps stabilize mast cells so they don't overreact. It also acts as a powerful antioxidant, helping to lower overall inflammation and support the immune system during allergy flares, especially when your body feels overwhelmed or reactive. I personally prefer whole food sources like camu camu or acerola, or powders with bioflavonoids like quercetin. Those added bioflavonoids help enhance absorption, provide additional support for the immune system, and histamine regulation. Especially for my patients with weak digestion, powders absorb better than capsules. For dosing, I usually do 500 to 1,000 milligrams daily. If I have a really sensitive patient, I will split up a 500 milligram dose to twice daily. And if someone gets loose stools, I will also have them do a lower dose and split it up. This is one of the most simple ways to start calming a histamine response while also supporting your body long term. Next is liver support. This is where most people go wrong. They try to block histamine, but they're not actually helping their body clear it. Your liver is responsible for breaking down histamine through phase 2 detoxification pathways. If your liver is sluggish or congested, histamine builds up. This is especially common if you have estrogen dominance, or on long-term birth control, or have gut issues. What I like to use is broccoli sprouts daily if possible, or calcium deglucarate, 500 to 1,000 milligrams per day. This helps break down excess histamine, supports hormone clearance, and reduces the recycling of estrogen and histamine. Next is something I use all the time in my practice: homeopathy. This works on the principle of like cures like. You're giving the body a signal to regulate its response. It's especially helpful while you're working on gut healing, minerals, and liver support. I often use Histaminum Hydrochloricum 30C. How to take it: before meals if you're having gut-related histamine issues like SIBO, or during flares like skin reaction, itching, mast cell symptoms. Let it dissolve underneath the tongue on a clean mouth. This can help calm immune reactivity, reduce flare intensity, and give your body breathing room to heal. The last one is biomagnetism. This is something I use personally to keep my autoimmune disease in remission. I use it with almost all of my patients in some capacity. Biomagnetism works by placing magnet pairs on specific parts of the body to restore energy balance, improve organ function, support lymphatic drainage, and also help with pathogenic load. And it is not just physical. It is working on the energetic and electrical levels of the body, which is something I believe is completely missing in most healing protocols. How to use it. You want to use medium strength magnets. Black is negative pole, usually on the right side, and red is positive pole, usually on the left side. Session time can be about 15 to 20 minutes depending on your location. Frequency can be 1 time a week to 1 time a month. You want to make sure to be really well hydrated before and to drink water after as well, because you will often urinate more. Biomagnetism often causes a flushing response. You want to be as relaxed as possible laying down, and please do not rush the process. The first one I would do is frontal lobe. This is for stress and hormone signaling. You want to place above the eyebrows near the hairline. Black on the right, red on the left. This pair is huge for people with chronic stress, adrenal dysregulation, or hormone imbalance. Second is submandibular. This is lymph and immune drainage. Placement is under the jaw at the angle. Black on the right, red on the left. This supports drainage of the lymphatic system in the head and neck. Third, this is pectoralis major. This is lungs and phlegm. You want to place upper chest above the nipple on both sides. Black right, red left. This is one of my favorites for people with seasonal allergies, asthma, chronic mucus, or phlegm. Next is thalamus. This is for immune regulation. Placement is at the center of the chest, just below the sternal notch. Black on top, red on bottom. The thalamus is your immune commander center. This helps regulate immune response, reduce overactivity like mast cell issues, and support overall immune resilience. Stomach and liver. So this one is histamine and detox support. Black on the stomach, left side, and red on the liver, right side. This one is huge for food sensitivities, histamine overload, and blood sugar instability. Sixth and the last is diaphragm. This is fungal gut and detox support. You want to place below the chest and breast line. Black right, red left. This supports fungal balance like candida, gut-liver connection, and detox pathways. A lot of people with chronic allergies also have underlying fungal overgrowth or gut imbalances. If you are struggling with allergies, food sensitivities, and mast cell issues, this is a reminder that your body is not broken, it is just overwhelmed. When you support minerals, liver function, and your nervous system, your body can actually stop overreacting. I will link everything I mentioned below, and if you do want a more personalized approach, I do work with patients one-on-one. And if this helped you, I recommend saving this video. You'll want to come back to this protocol.